Hello everyone, today I will be talking on endometrial hyperplasia. So what all do we need to know about endometrial hyperplasia? One is the risk factors. That is, what are the women who are prone to develop endometrial hyperplasia? How does it present? What are the signs and symptoms? How do we diagnose it? And how do we treat it? Now, any woman who has got an abnormal uterine bleeding, heavy menstrual bleeding, irregular bleeding, any bleeding which is unscheduled and she is not expecting, has to see her healthcare professional to be diagnosed and treated further. The women who are obese, that means their body mass index is high, who have polycystic ovarian disease, or who are on hormone replacement therapy. Also, the women who have got breast cancer and are being treated by a drug named as tamoxifen are the women who are at high risk of endometrial hyperplasia. How do we diagnose it? The first and foremost thing which needs to be done for a woman who has got an abnormal uterine bleeding with a suspicion of endometrial hyperplasia would be an internal transvaginal scan, which is an ultrasound which is done internally. This ultrasound will raise the suspicion if there is a possibility of any endometrial hyperplasia or if there is any other pathology inside the abdomen of the woman, pelvis of the woman, including the uterus and the ovaries. After that, the definitive diagnosis is made with the help of endometrial biopsy. That is, a small tissue is taken from inside the lining of the womb of the woman. Nowadays, it is taken with the help of hysteroscopy, which is a camera inserted inside, and the biopsy is taken. Coming to the treatment. Now, the treatment depends on whether it is endometrial hyperplasia with atypia, that is with some abnormal cells, or without atypia. Any woman who has got endometrial cells without atypia, the risk of developing it into cancer would be 5% in 20 years. The treatment would depend on what kind of hyperplasia she has. The first and foremost things would be to reduce the risk factors, that is, to reduce the weight of the woman, to stop the hormone replacement therapy. The treatment is either observation or progesterone therapy. When we talk about progesterone therapy, it can be either taken by mouth, that is oral tablets, or by an intrauterine delivery system, which is Mirena. Mirena is supposed to be the first line treatment for endometrial hyperplasia without atypia, and it has been found to give the maximum regression rates as compared to oral progesterones or observation alone. The treatment options can be discussed with your doctor and an informed decision can be taken for the same. Coming to endometrial hyperplasia with atypia. If the woman has completed her family and she doesn't want any more children, she can go ahead and remove the uterus. However, if she wants to continue and still wants to be a mother, the hyperplasia can be treated with the help of progesterones. There is a follow-up protocol to see if endometrial hyperplasia has undergone regression or not. That needs to be discussed with your doctor. I would advise all the women with abnormal uterine bleeding to please go and see your doctor and take the right advice from them. Thank you.